Welcome to the monthly member update for HACSU, your Health and Community Services Union. And we're joined by the State Secretary of it, Robbie Moore.
Thanks, Esther. Great to be here.
So you've just wrapped up a week-long celebration of our public sector health workers. That was incredible.
Yeah, look, this is something that we began during COVID when it was at its peak, and it was a thank you for workers who, when most of us were having to be at home, were still having to go to work every day. So we started a thank you for the work that you do in the health system, and we started by handing out scratchies. In the scratchies, we had some major prizes. A $600 prize was the first prize, a $300 prize, a $150, and then about 12 $50 prizes. And it's just been something that members really appreciate. We come out with a few other things that we give out as well, but it's just been so much fun getting out talking to everyone.
And where are we at with public sector? What are some of those big issues that HACSU is following up?
Well, one of the biggest ones we're facing at the moment is budget cuts. So the government announced that there would be an efficiency dividend. That's their spin for saying we're going to cut jobs in health and community services. So we're taking that on head on. We've put a number of stories out there in the media. One of the first ones that the so-called budget control committee did was they actually took away 2 positions from a program that worked with young people with eating disorders. These nurses provided weekly support for people going through a really difficult mental health condition, and has been a really successful program that has seen half the amount of people presenting or having to be admitted into hospital, and it's done some fabulous work. And these positions being cut is going to really affect young people with an eating disorder. It's a disgraceful decision by this government and just shows how cruel it is. And the worst thing is that this razor gang that are that are deciding to block these positions have not got anybody with a health background. No doctor, no nurse, no allied health professional are on there. So these decisions are being made, and there's just been some absolutely ridiculous one. Another one is that infection control cleaners at the Royal Hobart Hospital, 2 of those positions have been abolished, positions that were created during COVID. COVID and other conditions are still spreading throughout the hospital, yet we're cutting those positions, which will mean patients get sick and more things spread. So we're seeing really bad decisions that are putting the Tasmanian community at risk. Ultimately, this is a gutless government. What a government should do is, if it's going to cut services, it should come out and be transparent with the community and say, we're going to cut this program. But they're not. Instead, they're getting their spin doctors and they're getting the bureaucrats to identify positions to be saved without even being honest with the Tasmanian community about what they're doing. And that's why it's so important that we get word out there about what is happening, the truth, so that we can fight these and get the community involved in fighting to save these vital programs and services.
So where are we at with disability and aged care? I know on the previous member update vodcast, we spoke about the worker registration scheme, and you've since been to Canberra.
Yeah, last week, 2 of our delegates, Tanya Walker, who's a disability worker, also works in aged care on the North West Coast, and Brendan Etches, who's an aged care worker at Bishop Davies Court here in southern Tasmania, and myself headed up to Canberra to do some political lobbying. It was really good visits. We met with Tammy Tyrrell, an independent senator now, broken away from Jackie Lambie. We met with a number of people from the Greens, a number of people from government MPs as well, and had some really good discussions about how important it is to get a worker registration scheme for both disability and aged care workers. The response was really good, and we're really positive. We met with the aged care minister, we met with the disability services minister as well. So we had some really high-level discussions, and we're really positive that we can get this to be get it to be legislated so that workers will have a positive registration scheme that will recognise their training. It'll allow them to have ongoing training, which is often unfunded at the moment, and it will recognise the vital work that they do to ensure that their work is recognised for how professional it is.
And obviously HACSU has a campaign at the moment for portable long service leave. Where are we at with that? How's that going? And for anyone that doesn't know who it impacts.
Yeah, look, we've continued to progress that. We've now met with the Greens, we've met with the Labor Party, we've met with some of the independents as well, and had really productive discussions about trying to get this through the Tasmanian Parliament. I also last week met with TasBuild, who administer the portable long service leave scheme in construction industry. We've had that since the 70s. We just need to catch up to the construction industry. And we met with the CEO, and that was a really good discussion. They're happy to administer the scheme for us in the same way that they've expanded their scheme in the ACT and in Victoria. So we're certainly progressing that one. We're going to need some legislation drafted. That's the next step, and we're working through that at the moment. But we're certainly campaigning hard for that. A lot of members will have seen we've got petitions out there in your workplace, so please get them back. It's going to be vital to show the government and politicians how much support is out there for a scheme that will mean workers, just because they change employers, often not through their own choice, will still have an entitlement.
Robbie Moore, State Secretary for our Health and Community Services Union, the largest and strongest in Tasmania. Thanks for joining us.
Thanks, Esther.
If you'd like to stay updated on all the current campaigns, information, news and media around the Health and Community Services Union, you can do that on the socials and also on their website.